Peace and greetings to you guys. This is Omar Abdul Malik, the physician assistant and health educator. Somebody asked me in the comments section about what I do as a hospitalist. You can think of the hospitalist as somebody that acts as a kind of manager amongst the various healthcare teams. So what happens is that when patients are placed in, when patients come to a hospital for an acute episode, sometimes of a chronic position or a chronic condition, whether it's poorly controlled diabetes or CHF or COPD or something like that, they will come to a hospital to get rehabilitation or be treated for antibiotics, or the person has a really bad wound infection, they'll come to our hospital or a hospital and get treated just for a short period of time, a matter of a couple of weeks to maybe a few weeks. So that person is not seen by their primary care physician usually, or their nurse practitioner. They're seen by groups of other clinicians, and those clinicians may include registered dietitians, respiratory therapists if the person has got acute respiratory failure or respiratory issues, something like COPD or pulmonary hypertension. They're also seen by wound care teams, physical therapy, occupational therapy. Some of the people who I interviewed in some of my previous videos. You need somebody who's going to kind of communicate with the various teams and then communicate with the family members and the patient. And that's where the hospitalist comes into play. I love being a hospitalist because it means that I've got to know a little bit about everything. So I'm a jack of all trades, but master of none, which is okay for me. I think the hospitalist position is very good if you like talking to people, if you're a very good communicator, if you're able to take the sometimes very heady information of medicine and put it in lay terms such that people who are don't have medical knowledge can understand it, because the patients and their family members are very concerned, obviously, about their health. They've got to make decisions based on their understanding of what's going on. If there's somebody who's got a bunch of degrees and is not necessarily able to articulate it in terms that person can understand, or persons can understand, this can sometimes stymie the care of the patient and the decisions that the family members may make. In particular, if a family member wants to make their patient a full code, meaning if their heart stops, we would do everything we could to get it going again. So chest compressions, vasopressors, cardioversion, if need be. Or do you make that family member a DNR, a do not resuscitate? Or even in some cases, withdrawal care. These are decisions that will be based upon the person's understanding.
Respiratory 5745. Respiratory 5745.
Also, as the hospitalist, a hospitalist would look at a lot of the laboratory results. He or she would order necessary labs, and based upon their findings. So if a patient spikes a fever, you'd want to order something like a CBC. In that would include white blood cell count. You'd want to see if the person's got leukocytosis secondary to fever. Then do you put in a consult for the infectious disease specialist? Do you start the person on empiric antibiotics? If the person has got an episode of fairly profuse bleeding, do you order again, a CBC, and look at their H&H, their hemoglobin and hematocrit. If it's below a certain level,
Anita from respiratory, 5,700. Anita from respiratory, 5,700.
I got to stop doing these videos at work, but I try to give you guys some, what I think to be some pretty interesting vignettes after I finish my shift. But hospitalist, it's a relatively new position. I think it's less than 10 years old. They're very helpful if you are somebody who really likes internal medicine in particular. You like looking at labs, you like ordering labs, you like talking to various specialties. That includes everybody from the patient technician or the certified nursing assistant, asking them about the consistency of the person's stool. Was it a watery diarrhea? Did it smell really, really bad? Well, that can be a sign of C. difficile. So you got to do stool culture for that. To talking to the CEO of the hospital. When's the patient supposed to leave? When is he supposed to be discharged? Or talking to the attendings. Knowing when to get consults so they can address various acute manifestations of the patient's disease. But it requires that you have a fairly broad understanding of medicine. And of course, I'm a physician assistant, so I work in conjunction with the medical doctors, and I have a supervising physician. But a hospitalist can be a nurse practitioner, a physician assistant, or a medical doctor / doctor of osteopathy. So, if you're interested in it, please, there's a lot of information on it on YouTube, and you can, of course, Google it. But I hope this answered your question for those of you all who would be interested in a hospitalist position. Take care. Peace.